Welcome to Digital Health Talks, where innovators and changemakers share how they're transforming healthcare through technology. Join Megan Antonelli, who will be shining a light on the good things happening in digital health.
Hi, everyone. Welcome to Digital Health Talks. This is Megan Antonelli, and I'm excited to be here today with Dr. Brandon Welch. Telehealth is more than technology. It's about access, connection, quality care, and sustainable practice. The proliferation of virtual care and patient demand for care everywhere is fundamentally transforming how medicine is practiced, not just where care is delivered. Healthcare stands at an inflection point where virtual care is reshaping clinical practice, expanding access, and redefining the patient-provider relationship. The recent extension of Medicare telehealth flexibilities through December 2027, including home-based care, audio-only capabilities, and expanded provider participation, provides regulatory stability for this transformation already underway. Joining us today is Dr. Brandon Welch, founder and CEO of DoxyMe, which has facilitated over 8 billion minutes of care across 1 million providers in 176 countries. Through DoxyMe's acquisition of Telehealth.org and now excited to announce Health Impact Live's educational partner, Brandon is addressing a critical gap healthcare leaders consistently raise, moving from technology adoption to effective utilization through clinician-led, workflow-aligned training that reduces burden, supports compliance, and improves care quality. He's an NIH-funded associate professor at the Medical University of South Carolina and the author of Telehealth Success, How to Thrive in the New Age of Remote Care. Hi, Brandon. Welcome to Digital Health Talks.
Hey, thank you so much. And slight correction, we've had 12 billion minutes of telehealth delivered.
Oh, wow. Well, there you go. It's going fast. And that, we always talk about, and it was so great to meet you this week at Health Impact. And, you could replace telehealth with technology in some ways. I mean, there's, in that the patient success, clinician success, technology success, financial compliance, these are the elements that if you don't get it right as any kind of digital health startup,
any technology,
you can't, you lose.
Yeah.
And, and it's interesting in terms of with patient success, when you think about telehealth and telemedicine and virtual health and kind of, to me, I feel like we're in this place where patients are demanding it. We need it. We want it for various things. But if you turned it around and it had been something that hospitals or physician offices were almost pushing on their patients to say, you can't come in until you've done this. I do wonder if there would have been sort of a different, feeling about it, right? Like, oh God, I've got to do this. It's almost like having to, whereas because it's taken so long to get to that point where we actually do get it when we want it. And of course, not everybody does, but, in places where it is available, that success comes from the fact that it's almost been withheld in some contexts. And then we want. Right. Now, on the flip side, the clinician success is different. And I think one thing I hadn't thought about until I heard you and the folks at Health Impact talking about this is, clinician success, it depends on the clinician. It depends on where they sit. And that's even true. I mean, it ties to this finance and compliance because sometimes we talk a lot about whether or not health systems get reimbursed. And we talk a lot about how health system wants the patient in their office or in the building to get paid and have to have that. And now that those things have shifted a little in some places, in some, for some things, we're seeing the adoption go. But for providers, behavioral health and otherwise, that need is different. And what they are able to do and how many patients are able to see does actually increase. But that distinction between, sort of what financial success means for a provider versus a hospital, and then also what clinician success means in terms of the practice of care. So I would love to hear your thoughts and also a little bit more about telehealth.org and their role, in educating the clinician. I think a lot of the focus has been around, what is financial success, compliance success, technology. But as you get to that provider and what they need to know, not just about how to do it, but what is going to change in terms of the questions they have to ask, the patient onboarding, and even diagnostics. And I know some specialties aren't there, some specialties are further along, but I think it's really interesting as we begin to think about, this as, the digital front door being, where medicine happens first, and, as people want to age in place, and back to that mom who doesn't want to have to come in, pregnant woman who doesn't want to have to come in, 3 times a month for the appointments for prenatal care. What does it look like, and how does the practice of medicine change? And tell us a little bit about telehealth.org and how they educate and what that looks like.
Yeah, what's interesting is that with COVID, there was no opportunity for training on how to do this the right way. Everybody was thrust in, and we just had to do it and survive. Like, you're just surviving, you're just swimming, and you're just grabbing onto wherever you can. And we didn't have the time to train and get systems set up and do it the proper way. And we figured it out, and it led to some successes, but also some failures along the way. And it went from, telehealth was a luxury before, it became a requirement during COVID, but to some extent, telehealth has kind of gone back to it's a luxury where it's providers provide as an option to their patients, and patients can choose, I want to do by telehealth or in person, and providers will say, yeah, okay, we can accommodate whatever you want. And, and a lot of patients still choose telehealth. But as we go forward, I think there's going to become another critical inflection point where telehealth is not going to be no longer a luxury anymore. It's because of the aging population, the demand on the healthcare system, the limited number of providers, so more patients per number of providers. Doing inpatient visits is not going to be financially sustainable, or even be able to sustain the healthcare system in general. And in order to get care, they are going to have to look towards telehealth to lessen some of the demand on the healthcare system, where patients are going to see a provider remotely at home first before you go into an in-person visit. And that's going to come, and that is coming, and there's no way around that. The advantage we have this time, though, is that we do have time where we tested it, we're more familiar with it, and as we work towards that telehealth first model, where see somebody by telehealth first before you get triaged and sent in person, that's going to be required, but we have time to build towards that and train people towards that and do it the right way so that we can be successful and not fail again. And that's where we see the future of healthcare going. There's no way that the current model is going to be sustainable, and we're going to have to relieve some of the pressure through these telehealth services. And so let's train the healthcare system on how to do it right. And building on the book and the concept of the book, we say, okay, the book alone is the starting point, but it's really just a foundation. There's a lot of information that's coming. The technology changes. There's new policy updates. This book, I wrote it once, it's already out of date, but it's good foundational text to understand the basics, but you have to keep building. We need something that's living, that can live with and evolve with the changes. I don't think I really talked much about AI in this book, but now it's dominating all of our conversations. We have to talk about it. So telehealth.org is kind of like the living version of my book that adapts to the changes in the environment. And we also provide, other than pure knowledge, there's not much incentive to read this book. It's good to know it. It's good to have the knowledge, but you're not really getting much out of it besides that. With telehealth.org, we now have the ability to offer CME credits, which is something that every clinician needs to get. They have to get 20 to 30, whatever credits they need for their specialty. So that's something they have to do. They pay for it already. Let's just package this content, this education into a format they have to consume, and as a way to distribute this information. So we acquired telehealth.org, and we provide news, analysis, opinion on different topics in telehealth as they come up. We keep providers up to date on policy changes, technology changes. So we're talking about these new things that come out. And then we also provide the CMEs, courses, and webinars on latest updates. We just did a policy one for 2026. So it's a way to stay up to date. And the goal is it's a living resource to provide the training and education information to help the healthcare industry understand how to do telehealth the right way, so that when the time comes that they're like, we have to do telehealth, they're ready to do it the right way instead of being thrust into doing it the wrong way. So that's really the intention behind telehealth.org.
Yeah. Well, and I think it's so important. And as you said, it's like when that fast adoption where it was almost, it was a had to, and we did it, and it, we basically practiced the same medicine. We just did it virtually. Mm-hmm. And so what I think is going to be really interesting, and certainly as AI kind of factors into this, is how we can actually practice medicine better everywhere virtually than we did when it's visit based. I mean, to some degree, as you get into remote patient monitoring and wearables and devices, and, all of this sort of push and pull between, well, what are we going to do with all of that data, which is a completely understandable, response from the clinician. But now, as that technology to take that data and assess what's important and what's not, gets better and better and cheaper, although it's seemingly getting worse and more expensive at the moment. But I'm forever an optimist, and I believe that it will get better, and it will, I think we heard this week, there will be a point where not using AI becomes the liability, not who does the liability land on. And it's the same as you get into remote, after you release a patient and they, you have an ability to monitor them. We talked on the podcast recently with the folks from Iris Telehealth, and, they have capabilities of being able to listen to the voice and hear, indications of predictive, predictive outcomes for mental health. And so as those technologies get better and better, and care can be given better because we can give, in fact, more of it more effectively, the importance of this is just can't be understated. And I think that need to educate clinicians, knowing that, just as you said, a book is a book, and more often than not, a medical class and an education that happens, those courses are set, and this education and change is happening so fast that the importance of educating clinicians, as this technology develops, becomes so important. You talked a little bit around, kind of the policy side of things, right? And what does that mean? And I think as we step back and look at, it's taken, to some degree in healthcare, nothing happens until the government says this is the way it's going to be. And so you kind of, they force the hand a little. Where do you think, as we look at particularly like the rural health initiatives, sort of FQHC participation and, these telehealth flexibilities, where do you see that from a strategic planning place for health or care organizations? Where should they be looking? So to sort of shift from the clinician to the healthcare organization now, what do you see as some of the things that they should be prioritizing with respect to telehealth and virtual care?
I often look at, I don't know if you're familiar with the theory of disruptive innovation, or Clayton Christensen's disruptive innovation, where the small, simpler technologies disrupt the large incumbents and stuff like that. As I look at the healthcare system today, I view health systems very much as these large, slow-moving organizations that do everything. And I see a lot of these online telehealth companies that are providing not everything health system can do, but little narrow pieces as the disruptive innovations that are coming. So some like Hims and Hers. And, these large health systems, they do everything, but they're expensive and they're slow, and the results are compared to what you get for your money.
You're listening to Digital Health Talks. When we return, we'll continue our discussion on how technology is revolutionizing healthcare delivery. Stay with us to hear more insights on creating sustainable, patient-centered digital health solutions.
But then I see these very fast and nimble startup companies who are doing this one thing really, really well and efficient at a fraction of the cost. And, right now it's like, it's a little, mosquito or fly that these health systems are swatting, right? We don't have to worry about it. But what's it doing? It's eating away different lines of business. I think a mental health care is often not done by health systems. Health systems have kind of given up on that from a large extent. I mean, they're still providers, but they're missing out on huge opportunities there. I think of like men's health and women's health. Some of these weight loss drugs, they're losing that segment of the business now. And over time, there's going to be these different telehealth companies that start up that take different parts of the health system and do it faster and cheaper and more efficiently and better outcomes in the health system. And then the market, patients and health insurers, payers are going to be like, yeah, well, I'm not going to pay X amount of dollars for that large clinically health system to get mediocre results. I'm going to go do that. So go to that. And you're already seeing payers do that already in certain areas like the GLP-1s and stuff. And so I see this disruptive innovation playing out over the next probably decade or two. And I imagine that there's going to be more like healthcare at home companies that manage patients. They get deals with the health insurer to manage patients in their home. So patients can stay at home. They use technology. They use video devices to monitor patients and allow patients to stay at home rather than going off to some expensive in-person facility that costs a lot of money. I see the technology getting better. I see entrepreneurs seeing the opportunity, jumping in and building successful businesses, and that eventually eats away at these large systems that are expensive and complicated to use. And so I see that's where the future is going. And so in terms of like how health systems prepare, I'm like, watch out for that. Either you got to think about how to redesign your systems to be more efficient, to offer systems at a cheaper cost. Otherwise, companies are going to come in and disrupt you. And that's often my warning when I talk to health systems. Like, you're going to get disrupted unless you can do it as good as them.
Yeah, no, I mean, it's gone from sort of virtual care as as an access, as a thing to serve access to sort of, and to some degree build your, customer base because you can give care more places, to really, the hospital's blockbuster moment. I mean, if they don't, it's going to be, and I think your point about, the other, men's and women's health and the care that hospitals have not been able to basically make money on. I mean, that's ultimately what
they're missing out,
right? Yeah. I mean, because insurance hasn't covered some of the, those types of care, they haven't focused on it. And therefore all of these other, smaller, more nimble companies are providing it, and and aggressively and well, and people are getting what they want, and then it's providing a model for why doesn't my regular care look like this, right? I mean, that's ultimately what it comes down to. So
ultimately, what am I getting? I'm paying all this money, and I'm not really getting anything. What's the point of it anymore? And I think what's going to happen, the health systems are going to continue to retreat to the areas that they are reimbursed for, and it's going to be a lot of the in-person emergency, the expensive surgery stuff. And it's exactly the model that Clayton Christensen lays out in disruptive innovation. They retreat up market, and then the disruptors continue to eat away at that market until they are able to replace what those large systems do, and then they become disrupted. So they become a blockbuster essentially.
Yeah, no, it's and it is sort of, Clayton Christensen has been warning healthcare of it for so long, and then here we are, and it's really just happening. And then, what I find amazing is the more health systems I talk to, the more buildings they're building.
It's wrong way.
There's so much development and real estate.
Yeah, that's the problem. Is stop building buildings and focus more on building low-cost solutions, because it's good. Those buildings are going to be empty one day. Yeah. And in Clayton Christensen's theory, it requires these disruptions often come after a new enabling technology create an opportunity, and that enabling technology is the combination of telehealth and AI is going to make it so much easier and cheaper for companies to replace most of what those large systems can do. And that moment is now, and it's kind of like you got to be aware of that.
100%, no question. Well, and it, and while, health systems and the system that is in, we're here, we want to educate them, prepare them, and help them support. It is also, it is sort of a patient driven, that is what the patients are demanding. So, it's a scary thing, but at the same time, it is a positive development, and it's finding that balance. And I think what's great about what telehealth.org is doing is making sure that in that process, the clinicians as well, the clinicians remain, kind of educated on how to do this better and well as it develops. So, but as we always do, our silver lining, we always try to stay positive and talk about what's good. So in our last couple of minutes, why don't you talk a little bit about, and I think some of what we've already discussed is sort of the good things that are happening in healthcare, as you look at whether it's adoption rates or education or just virtual care delivery across the spectrum of the specialties. Tell us what you see as, that you're most optimistic about the future of healthcare.
Usually when I get asked questions like this, I like to go back to like first principles thinking. I'm like, at the end of the day, what is the purpose of healthcare? And the purpose of healthcare is not to make some company bigger or to, some market share and competition or whatever. That's all meaningless. What matters is a patient is sick and they want to get healthy. They want to get better. They want to get unsick. And so I say, well, what is good about what's going on? And I'm really excited about a lot of the new technologies, the digital health, telehealth, virtual health, also AI. These are all good things that at the end of the day are going to help patients get better faster for a cheaper cost. And healthcare is way too expensive, both from our national economy and both at individual level as well. And it's way more than it needs to be. But what I'm really encouraged by is like, boy, there's a lot of potential with this AI to do a lot of questions, to cut out a lot of waste, to allow people at the end of the day to get better, which is what they're consuming healthcare to do, is to get better or to stay healthy. And AI can do that much cheaper and more efficiently than the big expensive systems and ways of doing that now. And so I think what's good is that it's a very exciting moment in healthcare where these new technologies are technologies that are really going to help people stay better and get better and stay healthy at a cheaper cost. And that's a really exciting thing. And and I believe it's going to solve a lot of the systemic issues that exist in the healthcare industry with terms of access and coordination of care and traveling between different people and get information and coordinating all that stuff, all those problems that exist go away if you can allow a patient to get access directly from AI and answer their questions and get directed to exactly what they need, no BS, no markups, and make things more efficient. So I'm excited where technology is going, what's possible now, and what's coming. I think ultimately it's going to lead to, at the end of the day, better patients, healthier patients that stay healthy, get better quicker for cheaper price. And so I think that's really good and it's exciting.
Yeah, no, I agree. In fact, it's the disruption that is good. It is what's delivering, changing the care that's going to make it better. So tell our audience how they can, learn more, go to telehealth.org, get in touch with you, all those things.
Yeah, I would say if you're interested in telehealth and staying up on the news, just go to telehealth.org and sign up for a newsletter. We send out, I believe it's like a bi-weekly or monthly newsletter that goes out with the latest news and trends. And that allows you to stay up to date on courses and webinars and the latest news analysis that we have. And that's the best place to just stay up to date on that. Go to the website, telehealth.org. You can also find my book there. And it's free if you want the PDF ebook version or the audiobook. If you want the hard copy, you can just order it off Amazon and you'll get it. And then if you're interested, if you need telehealth software, simple and free telehealth app, DoxyMe, DOXY.me is available for anybody to use.
Yeah. Awesome. Well, and of course, as we discuss and further our partnership, we'll be sharing on our channel some of the courses that are going to be available to our audience as well. So, well, thank you, Brandon. It was great to chat. It was so good to meet you. I'm excited for everything that you guys are doing and how we're supporting it. And thank you to our audience. Very exciting times, and I think, as Brandon said, the disruption that's happening is a good thing, and we're getting to a place in healthcare where, that virtual care coupled with AI is going to provide the real-time care where people want it when they want it. So, thank you as always for listening and joining us. This is Megan Antonelli signing off.
Thank you for joining us on Digital Health Talks with hosts Megan Antonelli, Janae Sharp, and Shahid Shah. For more insights on healthcare innovation and a deeper dive into today's discussion, visit healthimpactlive.com. Join us next week as we continue exploring the technologies and strategies transforming healthcare.